I'm going to talk a little bit about ethics, values, and advocacy in this PowerPoint. Our objectives are to discuss the code of ethics and the ethical responsibilities of the nurse, define ethical principles that nurses should follow in practice, describe the process of problem solving through the ethical dilemma, and describe how to be an advocate in nursing practice. So values, main activities of the valuing process. We're choosing freely among alternatives after careful consideration of the consequences of each alternative. That's called the opportunity cost. We're prizing. Treasuring involves pride, happiness, and public affirmation. The ability to win praise from others. And acting, combining choice into one's behavior with consistency and regularity on the value, being integral with the value or having integrity within yourself or within the standards of your practice. Professional values, those altruism, concern for the welfare and well-being of others. That's one of the primary qualities of a nurse that was originally recognized way back when under Florence Nightingale, in the late 1830s, 1840s. Most nursing schools, when they have people do admission essays, are looking for that value of altruism from the applicant. Autonomy, the right to make self-determination. Just always remembering that people are allowed to make their own choices. We may not have to agree with the choices. We may not think it's the best choice. We may think it's actually a bad choice. People have the right to make bad choices. But autonomy is a basic human right. Human dignity, respect for inherent worth and uniqueness of individuals and populations, including providing them privacy, not sending someone through the hallway with their buttocks exposed, not diminishing someone in the presence of others. When you are a manager, not correcting someone in the presence of others. It's always better to take the person aside. Integrity, as I alluded to before, acting according to the code of ethics and standards of practice, and also consistent within the values you've incorporated into yourself. And social justice, upholding moral, legal, and humanistic rights. The Affordable Care Act has been called a triumph for social justice, meaning that it helps make universal health care, helps make healthcare available to everyone. The right to have, to not be food, what's the term that I'm looking for? Not to have food anxiety, that people have enough to eat. That's another common idea under social justice. Types of ethics. Bioethics encompass a number of fields of life sciences. Nursing ethics, formal study of ethical issues that arise in the practice of nursing. Analysis used by nurses to make ethical judgments. We'll describe each of these a little bit. Feminist ethics critiques existing patterns of oppression and domination in society, especially affecting women and the poor. So bioethics encompasses a number of fields. That includes medicine, genetics, physiology, the engineering at this point. Just because we can do something doesn't mean we should do something. Just because someone could go to surgery does that mean that that's right for each and every person. Nursing ethics, we more or less discussed that all the way through. Once again, ethical decisions and ethical dilemmas are not solely, life and death, ventilator, feeding issues. Sometimes they're as simple as, does the person who gets Christmas off this year, to be fair. And feminist ethics, I agreed. I mean, I'm obviously not a woman, but agree that there are definite glass ceilings for women in industry and in commerce and in healthcare. But as we've seen, with some of the crises we've had elsewhere, paternalism, priests that are the head of the family that make decisions and make decisions that are good for everyone, although sometimes they are for their own selfish gain, are not good things. Medicine has been called paternalistic, meaning the doc knows best. What he says goes. Everything is for the doc. So this is really antiquated. It's interesting that we've had the Equal Rights Amendment started in the 70s, but it was only ratified here within after 30 some years. Change in values occurs slowly. Okay, ethical principles, and you will definitely see these with examples on your tests coming up. Autonomy, respect the rights of others to make their own healthcare decisions. Once again, everyone has the right to make their own choice. Everyone has the right to make good choices. They also have the right to make bad choices, and they have the right to make choices that they don't agree with. We don't agree with. Non-malfeasance, avoiding harm, avoiding doing evil to other people. The Hippocratic Oath says, first, do no harm. In the Disney movie, the character, the evil witch, is known as Maleficent. It's evil. So once again, because we take someone to surgery solely for the purpose of doing the procedure. Is that person padding their wallet because they are taking that person to surgery and doing harm and risking injury to the person? Beneficence, the opposites of non-malfeasance, of doing good for the patient, to give them benefits of our care. Justice, as in social justice, giving each his or her due and acting fairly. As I've alluded to in some of my basic classes, there's patients I didn't like over the years, and I still needed to rise above that and give them the best care that I could. Fidelity, keeping promises. If you tell a patient that you'll do thus and so for them, you better do it. And if not, you should apologize that you didn't do it and let them know why. Veracity, authenticity, and accuracy. We don't falsify our records. We don't chart that we gave medicines that we didn't give. We don't divert medicines that were intended for patients for our own use or for the use of our family or for the use of another staff person or even another patient. Accountability, we're responsible and answerable for our own actions. It's not the devil made me do it. It's not we're working short. We are still responsible for our actions no matter what the situation is. And privacy and confidentiality. There was such a big problem with this that laws needed to be put on the book. The Health Information and Portability Act, HIPAA laws were put in place, and in order to prevent the sharing of information. Do you remember? It's probably been 5 years ago now when a family member went into the intensive care unit of it was Akron General at the time with a gun, and his wife, who did not want to necessarily be on a ventilator, he took the gun and shot her, killing her. And at that time, there was a write-up in the paper how a number of employees at Akron General were actually terminated for, looking up the private information of that man and his wife, knowing their address and knowing who it was and things. So seen it happen too when celebrities have been admitted into healthcare facilities and people have you know, delved into, you know, the medical record, you know, the electronic, the EHR, to get information on the patient. And you shouldn't share, you know, the information of the people, you know, the people that you talk to and treat in the hospital. Ethics is care-based approaches to ethical issues. Centrality of the caring relationship, keeping it focused on the nurse-patient relationship. You're not their friend, you're not their confidant. Shouldn't really have dealings, business or otherwise, with your patients. Promotion of dignity and respect for patients as people, giving them those certain inalienable rights. You know, delivering patient-centered care, having attention to the particulars of the individual patients. Cultivation of responsiveness to others, being available and willing and engaged with your patients. One of the nursing theorists that I learned about in graduate school was Rosemary Parse, and she had this kind of out there theoretical nursing theory that, you know, we are engaged on this journey with the patient, and that we should be fully present and fully engaged with them. Understood her concept, but she got a little out there with it. Redefinition of fundamental moral skills to include our virtues, making sure that we are working within that virtue ethic in our care. Our purpose in working in healthcare is not only to get a paycheck, but we're doing it because we want to be there, that we want to be altruistic, that we want to care for patients. You've worked with people that are simply there for the paycheck. So. You know, ethical conduct is our practice based on professional standards of ethical contact as well as professional values. Once again, repeating, cultivate the virtues of nursing, understand ethical theories that dictate and justify professional conduct. You know, one of the most common ethical theories that you'll hear is, you know, justice, that everyone deserves the same care. But you'll also hear about utilitarianism, where we should deliver the care that will give the benefit to the greatest amount of people. So, be familiar with codes of ethics for nurses and standards for professional conduct. Our code of ethics, and you've seen that in, I think it was week 1. It's a succinct statement of the ethical obligations and duties of every nurse. It's the profession's non-negotiable ethical standard. It is an expression of nursing's own understanding of its commitment to society. You know, those ethical standards are written by nurses for nurses. You know, it's a push from within our profession and not a pull from without. You know, it's not society pulling us to do these things. Give you an example of that. There's Robert Wood Johnson Foundation about 10 years ago came up with the idea, maybe a little longer, came up with the idea that nursing should have better education than what they do in order to enter practice or in order to be in practice. So the National Institute of Health, Institute of Medicine, which is what it called at the time, instituted the idea that by the year, I believe it was 2019, 80% of the practicing nurses should be bachelor's degree prepared. That 80% of the staff of any particular hospital should be bachelor's degree prepared. So that gave rise to programs like OU's, you know, RN to BSN programs, where the, you know, they, you know, had strictly designed for people that already had a bachelor's degree and were taking, like 12 to 14 courses. They were able, year and a half for most people, they were able to get their bachelor's degree. It's a really great thing. Never existed when I first graduated from nursing school. So that's a pull from without, that's a pull from the outside. The push from within, nursing. I'll give an example of evidence-based practice. It was nursing that actually gave push from within to making sure that the things that we do are grounded in good science and they are actually effective. That's a push from within. So ethical codes, how they can be broken, lack of boundaries, as we talked about that nurse-patient relationship, conflict of interest, not so much in nursing, but there was big, in the past there's been problems of physician prescribing medicines because they were receiving, gifts or money from drug companies. Dual relationship, this is a really hard one to talk about. We want to have the best care for our family, and we want to have the best care for the people we know. Yet, I don't think I'd ever want to take care of my wife inside the hospital. I really have always been uncomfortable taking care of people that I know, my neighbors, when they're within the hospital. I just think it creates a lot of places where confidences and our professional ethics and our professional standards can be breached. And just on a common sense point of view, if you're taking care of people that you're going to see for the rest of your life on a daily basis, and there's a bad outcome, you're going to see their family the rest of your life, and you're simply going to be associated with that bad outcome. So self-disclosure, making too much of your personal information available to the patient, and what that goes into our lack of boundaries. That doesn't mean you're not your own person when you're acting. We definitely bring our own personalities to our nursing care. Not keep maintaining our competency, not maintaining the competencies that we need to within the hospitals, not keeping our CPR up, not doing our continuing education, and then once again breaking confidentiality, as sharing information that we shouldn't. Ethics is a decision process. We have two or more clear moral principles, but this is a dilemma, but support mutually inconsistent courses of action, alluding to, once again, that utilitarian point of view, or delivering the best care that we possibly can to everyone. Ethical distress, when we're in that gray area and we don't know what to do, either personal or institutional or environmental. COVID is making it difficult to follow what we consider to be the correct course of action. So when we're trying to examine, an ethical situation, an ethical dilemma, we assess the situation, we gather data. Not only does that include data in the particular, the particular situation, but we also want to have a frame where we're looking at it from the outside, and we're looking at it, from the perspective of an outsider, and we want to look at, the literature of similar situations that have happened in other places. We're going to diagnose and clearly identify the ethical problem, plan out our options, think the problem through, make a decision, implement your decision, and evaluate the difference. It's an ethical frame point of view on our ADPI, our nursing process. So I'll leave you to review this on your own. How to relieve ethical distress. Probably a really good algorithm and flowchart to know for future reference. You know, hospitals have ethics committees. Um, the responsibilities and duties of those ethics committees are to make sure that the employees, the nursing staff, the physicians are educated, with, ethical principles, and that they are educated with those ethical principles in relationship to current things. I mean, we obviously don't have to worry about a shortage of iron lungs for people that have polio and they can't, are having difficulty breathing. But, we've now added genetic treatments, gene therapy to things. And just once again, because we can do something, should we do something? Policy making, looking at within the policies of individual hospitals, reviewing cases for breach of ethical or following ethical principles within the hospital, consulting on particular situations. We have a family that has a patient on the ventilator, minimal chance of recovery, possibly even brain death, and yet they don't want to have that person taken off the ventilator. I've seen that done for very selfish reasons. Dad will get a big bonus if he's alive October 1st, and here it is, September 25th, and can we keep him alive till then? Or can we keep him alive till after midnight? Or can we not deliver this baby or can we deliver this baby before January 1st so he becomes a tax deduction for the family? It sounds ridiculous, but sometimes even the ridiculous is models of reality. Okay. And occasionally it involves in research, both on how well ethics are adhered to within the institution, but they can also be involved in research, nursing research that takes place within the institution itself. There's called an IRB. So when in the past I've been involved in nursing courses where internal review board, I've been involved in nursing courses where the staff had wanted to do nursing research. They had to bring it forward in front of the internal review board to get approval. And the internal review board would look at making sure that what they should do, the study that they want to make, should be done, that the benefits far outweighed any risks, and that the patient/staff should be aware of any risks that may happen with the research, and also making sure that the patient/staff was aware that research was being conducted. So problems in practice leading to ethical issues. Paternalism, we talked about that, medicine always being right. Deception, diversion, obfuscation, where you hide things. A lot of times that deals with money or, sadly, drug issues. Privacy and confidentiality. Allocation of scarce nursing resources. One thing I learned in grad school is the definition of politics. It's the allocation of scarce resources. So sometimes politics are not always bad. There's no way that there's always going to be enough of something. Resources, money, electricity, medicines are, can often be scarce, and we're making sure that we're allocating those in an ethical way. Value consent or refusal, conflicts regarding new technology, short staffing, beginning of life issues, end of life issues, and unprofessional, incompetent, or unethical or illegal physician or nursing practice. I would add, sometimes our accrediting agencies make us, like the Joint Commission, comes in and mandates that we need to have standards set within our hospital, and we need to have a plan. Say, if we have a staff member or physician, nurse that is disruptive in the situation, or is practicing incivility or bullying towards another employee. So we have our ANA Code of Ethics to guide our practice. We deliver our care in a manner that protects the consumer, autonomy, dignity, rights, values, and benefits. Recognize the patient and family as core members of the healthcare team. Once again, getting back to that patient-centered care. Uphold confidentiality within legal and regulatory parameters, and assist healthcare consumers in making sure that they're making decisions, making sure that they have all the information that they need to, that no one is giving them only part of the information, for example. So maintain therapeutic and professional relationships, contribute to resolving ethical issues regarding illegal or unethical or inappropriate behavior, question practice when needed for safety and quality improvement, and advocate for social justice. We advocate for the patient. Our primary commitment is for the patient. Prioritization of good of the individual patient rather than society in general. Evaluate competing claims on the patient's autonomy and patient well-being. Some areas that concern us or can lead to ethical dilemmas include the representation of patients, someone speaking for the patient that shouldn't, promoting self-determination, making sure that the patients are allowed to make their own decision, whistleblowing when we see unethical, illegal practice, and being politically active. Once again, politics is that allocation of scarce resources. If we don't advocate for the patient and for nursing care, those resources can be directed elsewhere. Okay, thank you. I hope you found some value in this.